Giving a life on death row. Throughout this presentation, I will explain to you why prison inmates on death row should be able to donate their organs. Currently, no inmate on death row has been able to become an organ donor despite his or her request to do so. So why not allow inmates on death row to donate their organs? Many studies have concluded that there are ethical, practical, and moral barriers to allowing inmates on death row to donate their organs. In this presentation, I will demonstrate why this is beneficial for not only those on the transplant list, but also the inmates on death row. The decision to allow inmates on death row to donate their organs is ethical, moral, and practical. The outline. There is a large national shortage of organ donations, especially in comparison to an extensive list of those who need a transplant. The safety and health of prison inmates in the United States, as well as the safety of donating their organs. The manner of death, more specifically the lethal injection, is a primary use for execution in all 31 states in the United States that allow the death penalty. Prison inmates' ability to give informed consent on their behalf and to inform to medical treatments. The story of Christian Longo and his idea to give a life for a life. The reasoning is simple. If a prison inmate is able to give a life or heighten the quality of life of an individual, then why shouldn't that be allowed? Each day in the United States, 18 people die waiting for a transplant. Since 1976, over 1,430 inmates have died of execution, which is over 11,440 lives that could have been saved from organ donation, and many more organs that could have increased the quality of life of many individuals. According to Kaplan, allowing inmates on death row to donate organs, it will not beat the ongoing organ donation shortage the U.S. experiences. We are not looking to beat the shortage of organ donations, and that surely will not happen by allowing prison inmates on death row to be organ donors, but it will help save those lives in critical need of organs. Therefore, the impact these transplants may not be critical for seeing national changes in organ donation numbers, but personally can be life-changing for many individuals and many families. The safety and hematological health of inmates. One of the main concerns with organ donation from prison inmates is the safety of the organ donated and the risk factors associated with living in a prison environment. Kaplan argues that prisoners tend to be high-risk people. They have a lot of infectious diseases. They are not the best population for healthy organs. Prisoners tend to be in bad shape, and when you're on death row, you're not getting a good diet and a ton of exercise, when in fact prison inmates tend to have a lower rate of obesity compared to the general population of the United States. But how about other health issues? Although prison inmates have a generally higher rate of chronic illness and infectious disease, those inmates on death row can be screened and monitored well in advance before the execution and organ donation would occur, even more so than those organ donors who die of a heart attack or trauma. Therefore, with advanced screening and isolation before the execution, healthcare practitioners will easily be able to rule out any disease before the organ donation would occur. The lethal injection. The manner of death is important to make sure the organs are still able to be donated after execution, while abiding to the dead donor rule, where the patient must be dead before excreting organs. Therefore, the cause of death cannot be the removal of the organs. The lethal injection uses the 3-drug protocol for execution and is the primary method used in all 31 states that have the death penalty. The first is sodium thiopental to induce unconsciousness. Second is pancuronium bromide to cause respiratory arrest and paralysis. Last is potassium chloride to induce a cardiac arrest. With these means as primary method of execution, donation after cardiac arrest would be ideal. In a typical organ donation after cardiac death, the doctor would wait up to 5 minutes to declare the patient's death so the dead donor rule is not violated. The practical barrier here is that it would take too much time for the execution to take place, then transfer the inmate to a hospital where the donation would then begin to occur. This would be well over 5 minutes and the organs would not be viable organs for transplantation. If a doctor is on site for the execution, or the execution took place in a medical facility, this obstacle could easily be overcome. Also, with advances in technology like perfusion, allowing blood to flow through the organ so that it will not die, with this advance, healthcare practitioners performing surgery use this technique all the time, so why not use this to prolong organs for transplantation? These organs could also be considered as marginal donors if their viability is questioned. Although the organs would be at higher risk and considered marginal donors, with high follow-up, it is a possibility of saving more lives of those on the transplant list. Informed consent to medical treatment. Informed consent is an ethical issue surrounding many topics in health. Inmates living in an environment where there are constant threats and pressure that can skew an individual's decision. Many are concerned that inmates on death row do not have the ability to provide informed consent. Although the elements of informed consent are the nature of the decision is clear, the reasonable alternatives to the proposed intervention have been said, the relevant risks, benefits, and uncertainties related to each alternative has also been said, the assessment of patient understanding, and the acceptance of the intervention by the patient. These elements of informed consent can be easily met by educating the prison inmate on their decision to donate. Prison inmates do have one of the fundamental rights over informed consent of medical treatment. Therefore, why can't they consent to organ donation? Also, if we have taken everything we can away from these inmates on death row, they have no reason to alter their decision based on any sort of reward or punishment. By donating, they would not be receiving anything, nor nothing else would be taken away from the prisoner. Therefore, it would not be considered a coercive environment. A Life for a Life. The story of Christian Longo. Christian Longo was put on death row after being found guilty for murder. He requested to donate his organs after his death, but was denied. A quote from him is, 8 years ago, I was sentenced to death for the murders of my wife and 3 children. I am guilty. I once thought I could fool others into believing this was not true. Failing that, I tried to convince myself that it didn't matter. But gradually, the enormity of what I did seeped in. That was followed by remorse, and then a wish to make amends. His reasoning for donating was for remorse and redemption for what he had done. Kaplan argues that this would undermine the moral justifications of capital punishment. Although saving a life may be altruistic, the media nor the public needs to be involved in this procedure. And allowing the donors to be anonymous would take away any benefits that the prisoners would receive from society. Also, questions may be raised by the patient receiving a donated organ from an inmate on death row. If one's life is on the line, the organ that is being donated has met all criteria, and seeing the organ as an organ rather than the person donating this would surpass all other factors. Hopefully, this presentation has shown that prison inmates in the United States on death row should be allowed to donate their organs, even while considering any ethical, moral, or practical barriers.